So now we're going to move briefly into research and talk a little bit about research. Um, Healthcare is becoming more and more evidence-based, and EMS is part of that. So we now today look at evidence-based medicine as we're making decisions. Many types of treatment that I have used, for example, in my career, are no longer around because even though it was a good, it was there were good intentions of a variety of treatments and different procedures. There was no evidence, there was no research and medical evidence behind those. So we no longer have some of those today. So now we are looking at the entire healthcare process. So when we're doing research, we want to identify the problem. Is it a clinical problem, a systems problem, or an education problem? And oftentimes we find that there's multiple of these issues. It's not just one of them. We develop a research agenda. We come up with questions that we want to answer and methods for research and data gathering. EMS providers are heavily involved today in gathering that data. Everything that you put on your PCR with our electronic PCRs today, those are all data elements. And all of that goes into the National EMS Information System, which is a federal national database. There are institutional review boards to make sure that research is ethical and that it's appropriate. And then there's funding, and all funding must be transparent. It's important that if a research project is looking at a new medication, for example, that the pharmaceutical company not be involved in funding that project because of conflicts of interest. Or if you're looking at a new device, that the manufacturer of that device not be involved in it, that it be totally transparent. Different types of research. I'm going to run through this very quickly, but different types of research that are out there. And this is just a brief summary. You have qualitative research. These are questions surrounding events or processes. And then you have quantitative research, which is based on numeric data. And there's several types of these. You have experimental, for example, using the scientific approach. You have non-experimental, which would be descriptive, may involve interviewing patients. And then you have surveys. In EMS, there's a lot of retrospective research being done. And this is simply looking backward at things since we have patient care reports and electronic patient care reports and data gathering today. We can look back and draw conclusions on things that have been done on large groups of patients. There's also prospective research, which is looking ahead. It's looking at things that we might need to test in the future. So like, for example, a new medication that's not used right now, it goes through prospective testing and studies. We have cohort studies, which examines patterns of change over time. We have case studies, which is following a single case over time. And then there's literature reviews, which is looking back at research on similar topics and seeing what they found and somewhat summarizing those various research projects. There's ethical considerations of research. An IRB or institutional review board is the first step. And again, IRBs are designed to make sure that the research is ethical, especially if real patients are being used. The risks must not outweigh potential benefits, and they look at conflicts of interest, such as I mentioned before, with manufacturers being involved with this research. When human subjects are used, brings in other issues. These human subjects must give their consent. We have to protect their rights. They participate voluntarily. They're informed of the potential risks. So, for example, if they're involved in a double-blind study, a double-blind study simply means that Some patients will get a therapy, some will not, and the caregiver doesn't even know if they're getting the proper, or I'm sorry, not proper, the caregiver doesn't know if they're getting a placebo or if they're actually getting the new therapy. So there are risks in that, because obviously if you're getting a placebo and not getting the real therapy, then there's risk that their medical condition could get worse. But that's how research is done. And they're able to withdraw at any time. So it's important that the patients, should they choose to withdraw from the research project, that they're able to do that. So we will get some experience in evaluating and interpreting some research, EMS-related research. Some of the sections of a research paper include an abstract, which is a summary of the entire paper. The next section will be of the full paper will be introduction and background. So it's looking, describing the problem in the past, looking at things that the researchers want to look at. Then they'll describe their methods that they use. These are going to be statistical methods, methods of collecting data, methods of selecting patients, etc. And then after that will be their actual results. So this is a lot of, again, statistical and numeric data in the results. But then they have a discussion, which is a somewhat of a plain language discussion of the paper, what they found, what they wanted to research, and what they did and what they found. With every research project, there's limitations, so they describe those limitations. They make conclusions based on the research that they found, and they will also include any references that they use to perform their research. Interpreting and evaluating research is important for many reasons. Was it peer reviewed? So if research is being done by physicians, did physicians review the research project? If it's being done by EMS, did other EMS providers that are familiar with research, did they evaluate that data? What was the hypothesis? What was it that they were trying to show or trying to find out? Was the study approved by an IRB? Extremely important. And most research today would not be published without IRB approval. What population is being studied? What were the inclusion and the exclusion criteria? So if patients were included, what was the criteria for including them? If patients were excluded, what was that criteria? What method was used to acquire the sample? How many groups were the patients divided into? How were the patients assigned to the groups? And what type of data was gathered? Did the study have enough patients involved? Anytime you're dealing with statistics, if you have a low volume of study subjects, lots of times the data can be skewed. So it is important when you're looking at research to look at how many subjects were actually in the study. The greater the number of subjects, the better the research will likely be. Are there any confounding variables that are unaccounted for? So for example, are there variables that the researchers did not account for? Were there different things that the researchers maybe missed? Were the data analyzed correctly? This is going to be looking back at the methods and the results, and did they collect the information that they needed to collect, and then did they analyze that correctly? Is the conclusion logically supported by the data? Very important, again, looking at the conclusion toward the end of the paper, and is their conclusion supported by the information they found? Will it apply to your EMS system? This is very important because a lot of research is done in urban systems, and with rural systems, some of the research may not apply. Some of it may, and some of it, sometimes it doesn't matter. But you need to look at what the research was trying to show, what the researchers were trying to show with their hypothesis, and then was their research done in a manner that the information will apply to your system. And were the patients similar to patients in your EMS system? Again, kind of going back to the previous statement about applying to your system. How research is disseminated. It's disseminated in articles in newspapers and magazines, and articles in the medical press. These are typically trade magazines. So GEMS would be an example, although GEMS is no longer published in print. It's published online. But GEMS would be an example of a trade magazine. And EMS World would also be an example of a trade magazine. So they may report on research, but they're not actually publishing the actual research. Research in non-peer-reviewed journals. Sometimes peer-reviewed journals are important, but sometimes there's research out there that are in non-peer-reviewed journals that may be applicable to your EMS system as well. And research in peer-reviewed journals is considered the highest level of research that's done because it's not only the research team that is looking at that, it's other peers of those researchers that have reviewed their research, reviewed the methods, reviewed all the statistics to try to make sure that they are as valid as they can be. There's research presented by oral presentations at conferences. This may or may not be peer-reviewed, and typically this is some of the very latest research you can find. Research presented by poster presentations at conferences, again, may or may not be peer-reviewed. These presentations, oral and poster presentations at conferences, are oftentimes research that is in the evaluation process with peer-reviewed journals. And so they're presenting these at conferences prior to them being actually printed in the peer-reviewed journals. So we're going to talk about evidence-based practice. One thing that's important is that one research study should not change the way we practice. We need to have multiple research studies that show similar results before we really change anything that we do. EMS pre-hospital research is limited. However, our research base is growing. Our evidence base is growing every year. And today, EMS research is actually very healthy. Our patient care should be based on procedures that have been proven to improve patient outcomes. So it's important that we base our procedures on things that are shown to improve outcomes, not just maybe things that make us feel good. So, there's things that, for example, with paramedics, one hot button, and this has been going on ever since I've been in EMS, one hot button is, should paramedics be intubating? And the research is conflicting. There are research studies that show that we probably shouldn't, and there are research studies that show we probably should. So there's really no clear evidence one way or the other. People have opinions, but it's important to show what impact these various procedures, medications, etc., have on actual patient outcomes and try to take the emotion out of it. Some research from other specialties can be used by EMS. A lot of the research from the changes of the past 5 to 10 years on immobilization and long spine boarding, cervical immobilization, has come from physician groups. It's come from emergency medicine. It's come from trauma physicians. A lot of it came out of Canada from those same groups. So resuscitation research is probably some of the most prevalent that you'll see because we're always trying to improve resuscitation, CPR, defibrillation, etc. So resuscitation research is done through the International Liaison Committee on Resuscitation. This is an international group of which the American Heart Association is a member of, but the ILCOR sometimes sponsors research, but a lot of research comes through there that is not sponsored by them, but they vet that research, and they're doing, for example, peer review. The American Heart Association publishes their class of recommendations and levels of evidence, and I'm not going to go through these charts, but in most of the AHA literature, you can find these various classes. So they basically indicate how strong is the evidence, is there a benefit to risk ratio, and how good is the research that was actually performed. Okay. So EMS and public health. EMS has become more involved over the last 10 to 15 years in public health. There's been a number of epidemics and just different things that have necessitated EMS potentially becoming involved in public health. And so we know that a piece of EMS is in public safety, a piece is in healthcare, and a piece is in public health. So one of the things that we can help with, assist with public health, is prevention and public education. And we've been doing this for many, many years. We've been doing first aid, safety classes. We've been doing CPR. We do child seat classes, etc. So we need to have the emphasis on prevention, so that very similar to the fire service today, in that the fire service has basically educated the public out of fires, and so which is the reason that many fire services today, fire departments, most of their activity is actually medically based and not fire based. EMS collaborates with public health agencies on primary prevention and secondary prevention as well. Some public health accomplishments that relate to EMS: vaccination programs, fluoridation of water supply, helmet laws, sewage systems, formation of the Food and Drug Administration, clean drinking water, seatbelt laws, tobacco use laws, restaurant inspections, and prenatal screenings. So obviously some of these are EMS related, some are not, but EMS can be involved in vaccination programs, the helmet laws, seatbelt laws, tobacco use laws, and these sorts of public health prevention activities. So think about what are some of the ways that EMS agencies and EMS professionals can be involved in public health. So you might think about that, and we'll discuss that in class.